Okay, so I've washed my hands. Actually, I did just wash my hands. And the instruments are clean. Okay, so I think, what we're going to do is start with your ears. You said your ears hadn't had any pain, but when I push here, does that hurt? So I'm pushing on her tragus. Okay, now I'm going to look at your eardrum. Yeah?
Gotcha, this is for conference night, right?
Yeah.
Okay.
Yeah, and so we're doing your nose and throat. Why?
Connected to the respiratory.
Right. Any pain there? Okay. Now I'm going to look in your nose, so just look right at me. That's fine. Okay. Okay. Now if you could open really wide, stick out your tongue and say, ah. Ah. Good. So her throat looks good. She's got this cough, but she's good. Now you notice I didn't do her eyes. Okay. Okay, now I'm going to check her lymph nodes, and then we who are grading you on the final, we're going to say to you what the positive findings are. So Erica is going to say to me, you're finding one lymph node on each side. It's 1 centimeter in diameter. It's mobile, shoddy, non-tender. Or it even could be a little tender in somebody with pertussis. Okay, and then I'm going to check back behind for the posterior cervical chain. Nothing. I'm going to check in the superior clavicular areas for nodes. None. Okay, now, how are you with, can you take your top off or no?
Yeah, do you want me?
If you can. Yeah, it's always better to examine naked. Do you have bra on?
I do.
Okay. Weren't you in other classes have to? Okay, now we're going to listen. Before I do that, I'm going to come back here and check your thyroid gland. Could you swallow for me? Good. Okay. I was told by other faculty, it's okay, they're used to taking it. Okay. So now what I'm going to do is percuss your lungs, just like this. And I'm hearing normal sounds. Let's see an example. Okay. Now if you'll just open your mouth, take a deep breath in and out. Okay, and this time if you blow out real hard. Okay, now as the teacher, the grader, Erica's going to say, okay, when she blows out really hard, she's got an end expiratory wheeze. Okay, so the pertussis is giving her asthma. She had no history of asthma before, now she has it. Okay, deep breath in and out. Blow out again real hard. Good. Good. And she actually doesn't have anything wrong, of course. I mean, really you don't.
Okay.
And you have an ohm on your back, so you're safe.
I'm protected.
Okay. Deep breath. And one more. Okay, excellent. Now I'm just going to listen to your heart, so just breathe normally. Sounds good. Okay, the next thing we're going to do is your tummy. Now, and hold your breath, please. Okay, breathe. If you'll lie down, please. Now, with Dana W. here, we're not doing tummy. So when she's your patient, don't do tummy. She's pregnant. Okay? We're not doing her tummy. It's not mobile. Okay. It wouldn't hurt, it wouldn't necessarily hurt, but she requested and we're not going to do it. Okay. Any pain, let me know.
Okay.
Take a deep breath in and out. Okay. Another deep breath in and out. Okay, yeah, I feel her liver is about 10 centimeters at the most.
What's the average size again?
Well, it can be anywhere from 7 to 14, depending on the size. 7 to 12 usually,
Got it.
depending on the person's size. Okay, I'm going to check her aorta. I feel a good pulse there. It's nice and regular. Don't hear any bruise. Okay, and when I did her heart, I should have listened to her neck for bruise, right, in her carotid. Although, given that her problem is a cold, It's all right if I missed that. That wouldn't count against me on the final.
I have boots on.
You have boots on, so she would have her shoes off, for the exam, and her socks off. And I would be checking her I might check a dorsalis pedis pulse, and I might, I'm looking for edema, and I might push in a little bit to see if she has any pitting edema.
Even if she's complaining of cough, you're still going to...
Yeah, you wouldn't have to. It wouldn't count against you if you didn't. Okay? Oh, she's got good, we need lunch. And you know what, everybody should see these cherry angiomata, or do you all know about those? Remember under skin we talked about cherry angiomata?
Could have closed up.
So you reach a certain age, you get them. Usually it's 30. Once you're 30, you start to get cherry angiomata.
Only 29.
She's only 29, so, okay. So now, to find out her liver size, I'm going to percuss.
Oh, okay.
And it's getting dull here. And now it's tympanitic. So I know her liver's this span. So I've got 6.5 centimeters here, so she's about 7.5 centimeters. Okay?
So when it's tympanic.
And then when it's tympanic, there's nothing solid under it.
Yeah.
Okay, so take a deep breath. Okay, I can feel the edge, nice, smooth. Yeah, it's not tender.
No.
Okay. And then I just continue to palpate. Any pain there? Now, say she's somebody who had a lump in her neck, and I'm worried about lymphoma. I'm going to definitely feel for an enlarged spleen, right?
Yeah.
Deep breath, please. Okay. She doesn't have an enlarged spleen. You have a normal spleen. Okay. So she's good. Now, what if she had pain? What if she has gallbladder disease? What if she has an infected gallbladder? What if she has a history of 102-degree fever and a lot of pain and vomiting, and it's worse when she eats, after she eats? So, and I feel here, and pretend you're the patient with that.
Okay. Tender. Ow.
Ouch! Okay, it'd be more like, ow! Okay, ow! Okay, now when I let go, tell me if it hurts.
Yes.
Okay, she's got rebound tenderness. She's got an infected gallbladder, and it's infecting her abdominal cavity, so that's... So whenever somebody has abdominal pain, you want to be sure and check for a rebound.
Okay.
Now, I notice a lot of times you guys in your write-ups will put non-tender to percussion. I didn't hear about that.